It's my pleasure to have you here today. It's my pleasure and privilege, and the reason for that is because whenever I talk to you, it's fun for me. It is real fun, and the reason for that is because you're a very knowledgeable person. You have a common sense. That's why I trust you and I respect you very much because of a very simple thing. Because you're an honest man, and because you have a common sense.
Thank you. I wanted to return the compliment since today we're going to talk about medicine and health. So you're a professional in that. I'm just like an observer of how great you are. I know you have many patients and you saved a lot of lives and you continue to save lives. And I'm very grateful. I'm very grateful for what you have done for my family. You know, and I know you have more than 30 years of experience. I know that you're like spending a lot of time, continue to study. You never stop. You're never stopping to learn, and it's like that's why one of the reasons why you're such a professional, because you always believe that like every day is different and you need to learn more and more. You're not going to stop your education today. So now let's share your knowledge with our viewers.
Yeah, and the reason I want to share my what I learned. The reason for that's because listen, you may disagree with me, all right, but I don't trust all the studies, you know, because I am in the medical field for many years. I have my own opinion, and I know that sometimes you know studies are not that objective as we want it to be, and you know I try to learn from my patients, not from the articles on the internet.
I understand. Again, sometimes people say, "Oh, this person is weird." And then like 10 years later they say, oh, he was right, like we were wrong. Some person goes his own way, it doesn't mean that the person is wrong, you know, like so. And again, you have a huge experience, more than 20 years of experience, a large practice, and of course, you have a right to express your opinion. Again, this is not medical opinion today, but like we are going to talk about depression, if you don't mind.
Yeah, no, I don't mind at all. And depression is very interesting topic. The reason for that is because a lot of patients are coming to my office and they ask me to help with depression. And the reason why I am actually asked to do that because they don't want to take medications prescribed by psychiatry. What do you think about taking medication in general? If supposedly, I'm not saying that you are, but you know, supposedly you have something to be fixed. Would you like to take a pill, or maybe you will look for some other sources?
Well, now you're interviewing me, so there are two schools, 2 points of view. One is like doctors always going traditional way, prescribing tons of medication, but our organism is not a chemical factory, you know, like why to take all this medication? Maybe it's better to take like supplements or like something, you know, like some to take in the pharmacy some supplements, or like to eat fruits and vegetables, to breathe fresh air, you know, to exercise, and like maybe in the worst case something like, you know, like holistic medicine, you know, much better than to take all of this like medicine you prescribe.
The reason why I ask you is this, because I had to make the same choice, and this choice. The reason for that is because like I think 10 or 15 years ago I developed some heart problems, and they told me that the only solution is to take the pills, you know what's it called, the blood thinners.
Blood thinners, okay.
Listen, and for me, I said, you know, to myself that I don't want a drug to control my life.
Oh, so you're not a big fan of pills yourself, huh?
No, not really. I said that no, and the same thing if I'm just telling my patients that do you want to be a slave of a drug or no? And that...
Are you saying that people who suffer from depression should not take antidepressants?
No, I didn't say that. I didn't say that. But the thing is that, see, every person has his own way to go.
Okay.
And every has his own preferences. Some men love blonde, and the other part loves brunette. So who is right? Probably nobody,
Both.
because both, right? That's some people need pills, some people don't need pills, but it depends on what you're going to do.
Are you saying you can overcome depression without any pills? Is it possible?
It is not my my goal to offer the definite treatment for depression. That's not what we are doing. But basically, what I'm doing is to look and address the root cause of depression.
And what is the root cause of the depression?
It could be zillion.
Tragedy, family situation, like some tragic events in life.
Of course, but usually, who has tragic events in his family? Usually, it does not lead to full-blown depression, because everybody can grieve. That's natural, but nobody is going to call it depression or just treat with the pills. But sometimes, when it's people overreact, and even a small stress or some kind of this kind of tragic situation leads to profound depression. Yeah, that's not normal, because somebody grieves because he lost his mother or father. Yeah, that's natural.
Husband, son, daughter.
Yeah, of course, that's natural, and nothing wrong with that.
But you're saying not everybody going into depression.
Right. And
so what is the root cause of the depression then?
That's 1 second. That's what we are trying to tell you, that there is no one root cause, because depression is just result. It's the result. It's not the primary, because for the same result, you can. There are several paths. There are several ways that can get the result. So supposedly somebody becomes a millionaire, right?
Okay.
But there are zillions of ways how he can earn that millions of dollars, right?
Okay.
He can just trade stocks, he can do real estate, he can go to Las Vegas and hit roulette, That's a lot of zillions of reasons for that.
To rob some.
Yeah.
To rob billionaire.
I forgot that's very important. Yes, yeah. So what I'm trying to make a point is that to the same goal, to the same symptom, can be different ways, and how this very particular patient arrived to this endpoint that's unique, that cannot be predetermined, or it cannot be, we cannot look at the patient.
But from your own personal experience, you obviously treated a lot of patients with depression. Could you give me just like theoretical example, hypothetical example of a typical patient with depression? Not typical, okay, any patient with depression. What is, in your opinion, was the root cause of the recent patient you observed with depression? What could be the root cause?
In my understanding, so basically the whole idea is that, as one of my friends said, that the cause of depression originates below the neck.
What do you mean?
Below the neck means that it's not from in the head, it's just below the neck, means digestive tract, some kind of immune system, so whatever it is. But the whole point is that most of the depression, of course, some people have, supposedly, a long time ago I had a patient who had brain tumor, and he has psychiatric issues. Yes, in this very particular case, yeah, that's obvious, that's a brain tumor. Of course, there's another question how the guy got this tumor, but that was the point. So the person had brain tumor, of course, he cannot think, his mood was depressed, but most of the time, it's not. And basically what we are dealing here is there are two main, most often presentation of depression, where somebody doesn't want to move, he wakes up in the morning, he doesn't want to do anything, he would like to stay in bed.
Why?
Hold on, just that's one of the presentations. I'm just talking about presentations, and that's for the whole day, and mostly in the morning, sometimes who is in the evening. But that's the presentation. Patient just sits and he doesn't move. The another common presentation of depression, if he's depressed but he's anxious as well, it's a totally different story. In his actions, he's worried about everything, he's depressed. So that's another way of presentation, in my understanding. I'm telling you my opinion. So when the patient comes, supposedly patient comes and says, "Doc, I don't want to get out of bed." I don't want to do that. Just when I wake up, I just don't. I'm not interested in anything. Don't want to do anything, and I just want to stay in bed and just I don't want to even eat.
Wow.
So no, listen, it happens. I'm just a little bit of an extreme size, but an extreme part, but it happens.
But why
this,
does it happen?
this in this very particular situation, basically what we are trying to look for the hormonal causes of that, and basically the most common reasons why people have this is that their adrenal hormone cortisol is on the low side.
And why is that?
Oh, just let me go step by step. Why is that? Because hormone cortisol is necessary to for us to move on, to handle stress, to deal with everyday realities what we have. Because no matter what, you can protect yourself whatever you do, but as soon as you go out of this room,
Life is
you're under
stressful.
stress.
Of course. Life
And
is
you
complicated.
need to deal with this. If you don't have enough hormone cortisol, I don't think you can. I don't think you can, and that's why what we do, we look for this hormonal issue. Unless the patient has headaches, if patient has headaches, obviously I send him to MRI to check for the brain tumor. That's obvious. Okay, so that's why as soon as we have a confirmation, and basically we are not looking for, let's be clear on this, we are not looking for some kind of abnormal results. What lab is giving this as normal or abnormal. We are looking for the optimal results.
May I interrupt you for a second? So you're describing some of the situations, but again, did it happen overnight?
No.
Did it happen like today? Person woke up and said, "No, I cannot. I don't want to live bad. I don't want to do anything. I don't want to eat." It's probably something led to it because, like the year before was okay.
No, usually it doesn't happen overnight. That's very interesting thing because some patients say, yes, I woke up and I started to feel depressed. But when we question them, we find that usually it doesn't happen overnight. It takes a while. It takes a while. And the reason for that is because usually those profound changes, it's just too serious because it changes people's life and doesn't happen overnight, and usually cortisol, if the cortisol is the reason, so it doesn't drop its level overnight. It's not going to happen. You need to work really hard to bring somebody's cortisol down, really hard, because it's a master hormone. If the patient doesn't have enough cortisol, the rest of the hormones don't work.
So according to what you're saying, the best treatment is like to give pills. You just said in the beginning that it's not the only option, but to give proper pills, then people take these pills and then everything goes up and everything is fine.
But there is a tricky question. I mean, that's interesting question, but first of all, as per my knowledge, I am not aware of any antidepressants that were proven to be really effective.
Interesting.
Yeah, because that's kind of a very questionable thing, and the reason for this because let me remind you telltale. When a guy came to a priest and said, "Listen, I have trouble. My hut is very small, and I have my wife, my children, my father, my grandmother." And my hut is very small, so we can't live over there. Just do something. Can you ask God to give me a better place to live? And the priest listened to him and said, "Do you have some chickens or maybe some kind of this stuff?" And the guy said, "Yeah,
Pets."
yeah, pets." So the priest said, "Why don't you bring your pets in your hut?" And the guy said, "Okay, let's do that." And 1 week later, he comes to the priest and the priest said, "How is it going?" And the guy said, "No, it's no good." And the priest said, "Do you have some kind of maybe goat, maybe a sheep, maybe a lamb, something?" And the guy said, "Yeah, sure, I have a couple of them." And the priest said, why don't you bring it to his heart, to your heart?
I suspect I know the end of that.
Yeah, so the
After
final...
living with all of these creatures, he started
Yeah.
to feel so good about what he
Yeah,
did.
so basically that's the same thing, because what happens is that those drugs are creating the situation when people, you know, they become accustomed to a lot of serotonin or whatever it is, the mechanism depends, and then as soon as they're out of the drugs, they feel bad, yeah, because the drugs just made them, put them in the situation when
But
they
have
need.
you ever prescribed drugs when people come into you with depression? Or you sounded like drugs are not necessary? Or you say it's a
I never said that.
combination of factors.
First of all, drugs, I've never said that drugs are bad.
Mhm.
And here is why. Because as I said, some men love brunette and some men love blonde. So that depends on the patient's situation. Some people can do something else, some people cannot. Some people cannot.
I saw one man, he always like tried to supplement his antidepressant doing some physical activities. Because doctor told him like you have to just walk around in the park or every morning to do like this, you know, like, or to play on the piano, you know, like just maybe to distract him from his thoughts or just to make him more healthier, because it's healthy to walk around in the
Of
park.
course it is. But let me ask you this. Will antidepressant work is the reason for depression is low cortisol? I don't think so. And let me explain you one more thing. I think we discussed that before in our talks before. It is very, very important thing. There is in fact so-called down regulation. So what it basically means, as soon as we give a patient a drug, it influences the cell receptors on the cell wall and modifies them. Supposedly, drug is creating a situation, there's particular antidepressant, when there is a lot of there is more serotonin than is supposed to. Yes, it's okay, but the brain cell feels this, and he says, hey, there's too much serotonin. What are we going to do about it? And the result is very, very precise. The brain cell, cut down on receptor for serotonin. And as soon as the drug is given again, yes, it will just influence the neurotransmitter situation, but the receptors is not as many. And what happens is that the effect of the drug usually wanes off, and patients needs it again and again and again and more and more and more. That's basically, it's a common phenomenon. It's basic. It's not only drug, antidepressants. It's about
everything.
It's about any drug. It's about everything. It's like who is taking alcohol? Who starts taking alcohol, just one shot is enough. 1 year later, so one bottle is enough. That's exactly the same thing here.
So, when you are treating people with depression, what are you recommending them? What do you recommend to your patients besides antidepressants?
No, first of all, I'm trying, that's not my purpose to treat depression. My purpose is that my whole idea is to look and address the root cause. Address the root cause. And as soon as I find the root cause, then I can say, hey, we can probably fix it. There is no guarantee can be made because it's too complicated. Of course, nobody can give you, but we can manage this situation.
Well, for example, still, what are you recommending your patients, like to change the diet, to do physical exercise, and like I said, play with balls? What are you recommending to patients?
There's no particular recommendation. But once again, there is we need to look for the root cause, because root cause, just today, I had the patient who came with depression, and the reason for that was low cortisol secondary to his sinus infection.
Okay.
So I recommended him to go to ENT doctor who is working with me, and the guy just had procedure that he cleared his passages.
And that's all?
Well, sometimes it's all, not necessarily, but
It's
the guy.
another doctor cleared passages in his nostrils, you're saying, basically?
Yeah.
And it helped to fight depression?
I don't know yet, but that's what we are hoping to.
Wow.
Because listen, there's a case.
That's very unusual.
No, it's not.
Situation.
It's not. Let me give you another example. It's not depression, but basically that person actually was depressed, but because depressed was very interesting thing. That he had chronic headaches,
Okay.
and those headaches drove him crazy, crazy, really crazy. He went to almost all neurologists in the city, and the neurologist couldn't figure it out. And he said, one of the neurologists said, "But maybe hormonal imbalance is the problem." The guy came to me, and we fixed his hormones. Didn't work. So we looked for another cause, we thought it was toxicity, we detoxified him, didn't work. But sometimes God helps us. And the guy went to the overseas trip. When he came back, he said, "Doc, strange thing. When I was overseas, no headaches, no depression, I felt fine, nothing." Yeah, it's a real case.
So what did you say?
It immediately gave me an idea what's going on. I
What?
realized that was the sinuses, was allergies, and as soon as he went overseas, there was
Allergies?
no allergen over there, because in the United States we have different allergens than overseas. That's why he didn't have headaches, he didn't have any depression, nothing.
So you're saying he had problem with allergy?
He had problem with his nasal passages. He went to surgery, to make the story short. He went to surgery, passages were cleared, no headaches, no depression, nothing.
That's the story.
He's not seeing me anymore.
It was business, yeah. But the patient is happy.
Yeah, patient is happy. The patient is not coming to see me because he doesn't need me. He's
Good. That's a good example. So, but again, I read some of you have a very interesting website, www.drkalitenko.com.
Yeah, just www.kalitenko.com.
Kalitenko.com, even more simple, without that.
Simple, yeah.
Kalitenko.com. And I read there some of your recommendations, some of your ideas, how you feel about depression. And I did read it actually, on your website. And I found it you're basically saying, guys, you have to live a healthy lifestyle. Because you're saying, you have to walk more, you have to eat healthy food, and the more I read it, but that's called healthy lifestyle.
What I would say is that basically, if you are saying food, then I agree with you 100%. There is one caveat in this. There is one caveat. And listen, I learned it through, it was kind of very difficult path when I learned that. See, you can eat the best food in the world. You can take the best supplements in the world. If your digestive system is not working properly, it's waste of time and money. There are two conditions: food and digestive system. Now, of course, I'm kind of simplifying it. I had a patient who was complaining of different complaints and different problems, and we figured out that one of his main problems is very high level of lead in his body.
Wow.
And guess what happened? We detoxified him. We detoxified him several times. Guess what happened to the lead level? Went up. Up.
Why?
That was the very interesting question. The guy was shot. He was shot with a bullet. And nobody removed the bullet. Yeah.
And he didn't tell you this in the beginning? Or he did tell you?
Thank God he did. He did, and that's why when we detoxified him, if he didn't tell, he would be in very good.
Then maybe he needed surgery.
He eventually did.
Oh.
He had surgery, and his lead level is going down, right?
Oh, okay.
Okay, so I'm just trying to show you how complicated it might be. Can you imagine a bullet in his body?
I hope you're not trying to scare our viewers, but stories are...
The guy is not a gangster,
Yeah. So to summarize, every case is different, and before you're treating from anything, including depression, you're trying to determine the root cause of any problem.
Exactly.
I know that you're very good at Diagnosis.
I'm not very good, but I'm trying to. You know, I believe in God. I hope that God just guides me. That's basically what I'm going.
God is good, but also your practice, your experience, your knowledge, your education, and especially your experience with so many patients. You're already like feeling sometimes intuitively, sometimes because of your previous experience.
Yeah, it's more art than science. I agree with you.
What is like? Let's test here. Let's send person to like MRI. Let's check digestive system. Let's check passages, etc., etc., etc.
Yeah, sometimes when a look, one look can lead to diagnosis, you know, but it's not common. But that's pretty much what we do. The main idea, the main idea in our practice, what we do is to look for the root cause.
So basically, how do you find it? Like doing different tests, taking blood tests, etc. I don't know what exactly are you doing, but different tests, correct? Different to check every part of the body.
No, it's a little bit different.
Different?
Different. Basically, how it works, at least for me. At least I'm talking about myself.
Only your own experience. Yeah.
So basically, as soon as I get a patient, I just get the history, physical, and then I think, what might it be? What might it be? So I have several hypotheses, some kind of clinical theories. And then I go and do tests, either to rule it in, my theory, or rule it out. Because I'm not always right, and quite a few times I'm wrong. So if the test proves, if I have objective ways to prove that I'm right, then it's okay, we go on. But if I'm wrong, and it happens all the time, you know, sometimes I see a test and I see the result that totally contradicts my initial theory. So I'm telling myself, Doc, you're wrong here. You need to choose another way. And it's
another direction.
Yeah, another direction. You have to look from different angle. You need to look for something else. You know, that's the most important thing. Ari, that's the most important thing. If somebody is telling you that he is always right, there is a problem here.
Yeah, I'm like surprised. Doctor, I'm talking to a doctor who is saying publicly, I'm not always right, I'm often wrong. I'm like,
listen,
usually
that's
like instead of it, like when you see commercials on TV, doctors saying like, I'm always right, I'm saying this, I know this, everything is perfect, you come to me, I solve all problems.
If you want a doctor who knows everything, it's next door, next door, okay? That's not me. Listen, I'm telling my patients that supposedly, I quite often tell them, supposedly this is not my field of expertise, you know, I cannot know everything, I'm not always right, but you know, we need to see, we need to test, if it works, fine, if it doesn't work, then we will look for something else, but that's life.
I can again, because it's my experience and it's my family and I can share it with you, that when I called Dr. Kalitenko, it was many years ago when my mother was alive, and I brought her to Dr. Kalitenko. By that time, all of us and her previous doctor, we felt that she had a big depression, and like all this antidepressant, nothing worked, and she became worse and worse. And Dr. Kalitenko looked at her, checked everything, called some of his colleagues and decided to send her for MRI, because he became immediately very suspicious. When he looked at symptoms and everything, Dr. Kalitenko became suspicious that this is not typical depression, that this is something related to possibly brain tumor. And unfortunately, in this case, unfortunately, he was right. After MRI showed that, and CAT scan showed that my mother had a brain tumor, and though Dr. Kalitenko or anybody else couldn't save her life, but because of his prompt and very professional actions, the 2 days later she was already in Maimonides, not in Maimonides, I'm sorry, in Sloan Kettering Center in Manhattan. She had a surgery, and they removed not all but most of her brain tumor, which was very big, 6.5 centimeters. She passed away 3 years later. So I'm very grateful to you. I feel that you gave my mother 3 more years of life. So she saw the birth of my daughter, etc. So thank you very much. But the point is how important proper diagnosis, how important to check everything, to find what is really going on, because person could be feeling problem in ear and then we realizing it's not ear, it's something else.
Right.
Same story with depression. Everybody was convinced she had a depression. It was not a depression, it was a brain tumor that affected her brain, you know. So when you found it, I decided to share. I can do it. You couldn't do it, but I can do it. So I said, thank you. But coming back to the topic of depression, I believe family is also very important. I know that you're very strict on confidentiality, etc. But sometimes, especially when you're dealing with a person with depression, family could be very helpful.
In my opinion, if I think that's like 50% of success.
Oh, you see?
And the reason for that is because I'm telling you that without my people who live with me, you know, I wouldn't be able to do anything for my health.
Oh.
And it's very clear, because how can you change your lifestyle without your wife, without your children, without everybody else? You can't do it alone.
Parents, siblings, yeah.
Right. You can't do it alone, and that's why I think the family is probably, if not number one, but number two for sure.
Oh.
Number two for sure. You can't do anything big alone. No way. Even see, we are here together, right? I'm not talking alone. Why? Because I can't do it alone, because I need you to give some knowledge.
But I'm not part of your family. But I know
no, I'm not saying that, but
you have people in your life who love you so much and help you.
Who is giving love? Love is very important. You know, if somebody, especially
not just depression, but with any.
Yeah, but depression is very important too. If there is a loving person next to the patient, it's a very, 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 very important thing. It's a very big step forward. And that's really important thing, so we are trying to engage as soon as. Usually, you know, people, the patients, they don't make too much just trouble in saying that if you can't talk to my wife. No, usually they bring wives
themselves.
Yeah, just, you know, and because really a wife or a husband can help. They can. They really can. Okay, it's indispensable. And that's why.
So that's a very good advice. In this case, it is advice. I know you're very careful that this is not just giving advice to anybody, but having a loving family member helping to prevent depression.
Yeah, that's basically what
helping to not to cure depression, but to fight, to overcome depression.
Yeah, why I'm saying that I'm not giving any advice on the regular basis is because there is no advice that fits everybody.
Correct.
How can you do that? You can't. Yes, you know, and that's why every single patient is different. Take my word for this, please. Every single patient is different. There's no two same patients. And I don't know why people think that the same pill can fit millions of patients. I don't know that. Maybe I'm missing something here, but I just don't understand that. How can one pill fix a couple of millions?
But again, talking about pills, sometimes I hear stories, not from doctors, but my husband took this pill, it helped him, so you can go to a pharmacy and they will give you but it's wrong. They have to still talk to a professional before. It doesn't work with everybody the same, you know. So.
It's so-called placebo effect. it does work, believe me, it does work, but that's not what we try to do.
What works with someone else not necessarily could be helpful in someone else's case.
Of course. But we are trying to, once again, we are not giving placebo, we are trying to look and address the root cause. That's what we stand for.
Thank you so much. I believe for our first interview it's more than enough first time.
Actually not first time, no, it's not.
No, it's not our first interview.
Yeah, first here, in this very room.
In this office, yes, in this office. Yeah, you were in the studio many times, of course. And we talked many times before. Thank you so much.
Okay.